Again. Hi, I'm Bob Weir with another interview of people in the news covering significant issues in North Texas. My guest today is Dr. Matt Richardson, Director of Public Health for Denton County. Dr. Richardson is here to answer some questions about the COVID-19 vaccinations that might be on the minds of residents. Thank you, Dr. Richardson, for taking the time to provide this valuable information.
You bet, Bob. Thanks for having me.
All right, if you would please begin by telling our viewers your role as Director of Public Health for the county.
Sure, it's a unique one. I'm an appointed local health official, so I'm appointed by the Commissioner's Court, the county judge and commissioners for Denton County. It is an appointment. It is a noted responsibility in Texas statute. So the local health officer has some responsibilities and duties that are outlined in the Texas Constitution around the provision of public health services and protections. Think about quarantine, think about isolation, think about those responsibilities that are outlined in statute. That's sort of the high level local health official. You know, you'll hear the terms local health officials. It's not necessarily a generic term. It really has some statutorial precedent and a governmental role. Obviously, being appointed, I'm also a department head. So our Denton County Public Health Department is about 150 staff members. That ranges everywhere from administrative staff to obviously clinical staff. We do things like tuberculosis clinics, immunization clinics, STD, STI clinics, primary care. We have a diabetes prevention management program that is funded partly by a Medicaid grant. We have public health preparedness, which you've seen enacted all through the COVID-19 response. Really, public health is a multifaceted department, and we've got a lot of spinning plates.
I can imagine, yeah. All right, how about approximately how many vaccinations have been administered so far?
We've done, I called this up just for this interview, we've actually done 156,000, almost 157,000 vaccinations. And that was as of Wednesday. So that number was that total. Yesterday, we did 11,200 additional. And then today, we've already done roughly 3,000 vaccinations today at Texas Motor Speedway. So the list grows, the number grows every day.
Right. And for those who may not know, how does someone get on the vaccination list?
You just simply go to our website at dentoncounty.gov and you'll see a vaccine wait list button right on the splash page. You hit the wait list button. It's called our vaccine interest portal. You go to that portal, you enter your information and you enter how you're eligible. Once you do that, we invite you at the next available clinic. You get a QR code, you come to the clinic. We scan your QR code. We verify your identity assigned to that QR code. We give you a screening form. We screen you. We make sure that you don't have any contraindications for vaccination. We vaccinate you. We put you in a holding queue and make sure you don't have a reaction. And we send you on your way.
Excellent. Yeah. And I have that link on the written portion as well.
Excellent.
Currently, where are vaccinations being administered?
Yeah, so Denton County Public Health is a hub. We are working in partnership with Texas Motor Speedway, with county departments. And as a hub, we're using the mobile clinic application, and that is only at Texas Motor Speedway. Now, we're not the only vaccine providers in Denton County. So private providers, hospitals, physicians' offices, urgent care, lots of providers have some vaccine. But Denton County Public Health, we are designed by the Department of State Health Services as a hub provider. So we are a mass vaccination site, and that is currently at Texas Motor Speedway.
Okay, and right now, that's the only mass vaccination site.
It is the only hub in Denton County designated by the state.
All right. Who provides the county with the vaccines?
So the federal taxpayer purchased these vaccines. Those vaccines are allocated to states. And in the state of Texas has a vaccine allocation committee, and they allocate portions of vaccine all across Texas every week to both hubs and private providers. And again, I'm not going to say it's free of charge, because every federal taxpayer has paid their fair share of the vaccine, but it does not cost the state of Texas, nor does it cost Denton County taxpayers additional dollars.
I got you. I got you. All right. I know that Pfizer and Moderna vaccines have been used. Is there another one such as the one-dose Johnson & Johnson vaccine also in use?
So Johnson & Johnson has been, it has been certified with an emergency use authorization, the EUA, by the CDC. Lots of vernacular, right? Lots of jargon on initials and acronyms. EUA, emergency use authorization, the CDC, the Centers for Disease Control, they certified that vaccine. We have not been allocated any Johnson & Johnson vaccine as a hub. Early on, we had mostly Moderna in January, and late December, early January was Moderna. When Pfizer was approved, there was sort of a transition. And now we exclusively get Pfizer. That Pfizer is more difficult to manage. It is the ultra cold vaccine. We have ultra cold freezers in Louisville and Denton that we store it. It is a more difficult vaccine. It also has to be constituted. So you have to take a solution to reconstitute frozen vials, whereas the Moderna is just a one vial application. The Pfizer is a little more complicated. It comes in two parts. We mix them, and then we give the vaccine. Johnson & Johnson, and both Moderna and Pfizer are 2 doses. Pfizer just more complex to formulate and to actually administer. Johnson & Johnson is a 1-dose vaccine, which is marvelous. You get 1 vaccine and you're done, one and done. But we have not been allocated Johnson & Johnson in Denton County as of yet.
And did you say that Pfizer is being used right now?
Yes, so we are almost exclusively Pfizer. It's just the way the cookie is crumbled in Denton County. That's just what's been allocated to us by the state of Texas. I do think we've been maybe a victim of our own success. It's the most complicated vaccine to work with, and yet I think we've given so many and used the Pfizer that unfortunately I think we've sort of become a de facto Pfizer provider. It's just
good news.
The way it's happened.
Actually, that's good news. I think most people know that the vaccinations are administered to them in their cars. Just for information, what type of information should they bring with them?
You bet. Once you sign up on our vaccine interest portal and you are invited, we actually send you an email to make sure you're still interested. We've had so many people be vaccinated either outside the county or by another provider. So we want to make sure that we don't have a high no-show rate or we don't have a high cancellation rate. So we actually send you another email asking you to opt in to make sure that you're still interested. If you are, we send you a QR code, an appointment verification for that day. So we ask that you bring that. That helps us verify you. And we need another form of identification that we can tie to make sure Bob Weir is Bob Weir. And we make sure that we've got the right folks in the car.
Generally, the driver's license works.
You bet.
Yeah. All right. Doctor, have you heard of any unpleasant reactions to the vaccine?
Yeah, there are some. If anybody's had a flu shot in their life, a COVID vaccine has some of the similar effects, and some of those are to be expected. Soreness at the site of injection, usually a few hours after being administered. The actual vaccine is usually not unpleasant at all. So it's just a very minor stick, and I've had 2. I did have a first and a second dose, and I didn't feel the administer of either one. The first dose, I had a very sore arm, kind of up in my shoulder, just in my bicep, just had a sore arm. The second dose, I had some flu-like symptoms. I didn't run a fever, but I had some fatigue and some body aches. It did not last very long, just a few hours. And it was not very severe. I did take some ibuprofen, but those are the typical side effects of the vaccine. Some of those are good news. So whenever you have a systemic reaction, when you've got a little fatigue, a little body ache, that's really an indication that your immune system is reacting. It's producing those antibodies, which is exactly what we want. We want you to produce those antibodies so that when you're exposed to a pathogen, your body can fight it effectively. So that's good news. Mild reactions, good. We have not had very many severe reactions at all. We do monitor people in a waiting area after vaccination, post-vaccination, for 15 minutes or 30 minutes if they have had a prior reaction to a vaccine. And we have a physician on site that actually assists us with EMTs. We have people monitoring those individuals post-vaccination to make sure they don't have any severe reactions. And we've had just a handful of those. And we have actually transported, out of 156,000 shots given, we have actually had EMS transport maybe 10 or 12 people over the last 3 months, and no more severe reaction than that, just for precautionary measures. We worry about anaphylaxis, just that a systemic reaction, a really allergic reaction that you would think about hives or swelling. So we monitor for that, and we've had very few instances and no fatalities, of course.
Well, that's great. On a personal note, my wife and I had both of the Moderna inoculations spaced a few weeks apart, and we were really impressed by the well-organized and speedy process. It took us all of 30 minutes from the time we arrived until the serum was injected into our arm. So, I mean, it doesn't get much better than that. But when you think of the thousands of people that are being vaccinated, honestly, the county is doing a fantastic job. And I say this because I have friends and relatives across the country I speak with, and they haven't had theirs yet, and many of them don't know where to go for it. They just haven't even been informed. So again, kudos to the Denton County officials, to you, and to all those volunteers.
It's a team effort. It really is. And the volunteers, I hope that when you were out there, you saw really the community coming together.
Absolutely.
There's some unity that we might have been missing in 2020. And I think that unity of every color and creed, I think every race, every ethnic group coming together in a large scale response for a community benefit, that's been really encouraging, I think, for many of us. And the vaccine is so hopeful. I think people, like you had mentioned, it's this idea of coming together with family and friends when we've been isolated from each other. Right. It's a hopeful, emotional experience. It was emotional for me personally. I've had some chronic health conditions and a cancer survivor, and I will tell you it's a special thing to have some hope and really a community effort to share.
Exactly right. Exactly. That's just how we felt when we got there, and the way we were treated from the moment we were there to the
Great.
The courtesies, the organization was marvelous. All right, let me ask you this question. Now that the governor has lifted the lockdown and the mask wearing mandate, do you think it's safe for people who have been vaccinated to gather in groups? And do you think they should still wear masks?
So the first answer is to the second question. Yes, we should still wear masks. I'm vaccinated. I wear a mask anytime I'm outdoors or coming into groups of people. I have had my second dose. So mask wearing is still essential. And we'll talk about that in a second. The idea of lifting the mandate, I certainly understand the governor and his decision there. I would note that it is important, and the CDC notes it's important. They have some specific guidance at cdc.gov about after you're vaccinated. And one of the things they talk about is you can safely meet with another household or a group of people who have also been vaccinated, and you can meet with them safely without masks. That makes sense, right? So everyone that's fully vaccinated meeting together, that does make sense. Even people who have been fully vaccinated can meet with another household if they are not vaccinated. One household, really, the idea is a smaller group of people, but you can meet with unvaccinated individuals. Again, this is sort of intuitive.
Yeah. And that would be because you've had your vaccination.
That's correct.
So you can't affect them and they can't affect you.
Right. And now I think the limitations there, though, are you want to make sure that they're not high risk. Because again, we think that vaccine is highly effective in the mid, maybe even to the high 90 percentile, but that's not 100%, right? Right. So we would just note that when you just apply the math, if someone in the unvaccinated household is high risk, that's more concerning. And so we would still recommend masks in that instance. But if no one in that household is high risk, then there's a lot of comfort scientifically there. And then again, meeting out in public, because of the variants, and I would just note that the UK variant B.1.1.7 has been detected in Denton County. The CDC anticipates by late summer that will be the primary circulating pathogen, that UK variant. The good news is we think the vaccines are very protective against that one.
Good. Okay.
The bad news is other variants are on the horizon, and the vaccines may or may not be as protective with those. So again, that explains the mask. We want to race to get as many people vaccinated as possible so that we can fight just COVID-19 in general. And then if we have fewer and fewer and fewer cases, if some of those are variants, we're sort of protecting and cocooning the population. So it's not the time to let up on the accelerator. We need to get vaccinated. We need to wear masks for a little longer and get as many people protected as possible. Then that really limits the transmission, and then the variants are not going to be as much of a concern. But right now, with maybe more than half of the nation, obviously more than half, not vaccinated or maybe infected, we still have a large percentage of vulnerable individuals, and we've got to protect them.
Right. Something else just occurred to me, and I have to ask you, do you foresee the possibility of these vaccinations being an annual thing?
So it's back to this previous conversation of variants. And I have an example. The reason you have to have a flu shot every year is the flu virus changes,
Right.
okay? And it changes because maybe a quarter of the US population and a quarter of the global population gets the flu. Now imagine how many times that virus is replicating. Trillions and quadrillions, and I don't know what a number plus 20 zeros would be. The numbers of copies of replications of that virus. Whenever it replicates that many times, that's evolution in its purest sense. It's evolving rapidly, okay?
Right.
Now think of measles. You don't have to have a measles shot every year. Why is that? Because nobody really gets the measles. We have a couple hundred cases in the US, maybe 1,000 cases of the measles every year in 330 million Americans. It doesn't replicate very quickly. So that vaccine is as effective as it was last year because the virus is essentially the same because not very many people got it and it hasn't replicated as quickly. So COVID-19, if we can stop the transmission, if we can really do our best to limit transmission with vaccine and physical distancing and masking, then it's going to have fewer opportunities to change. And if it has fewer opportunities to change, then the vaccine and the antibodies you already have are more likely to be effective. Does that make sense?
Oh, absolutely. Yes, sure it does. It's so interesting. I could talk to you all day about this, but I have to move on. We are coming to a close, and I'd like to just ask you, is there anything else you'd like to add?
Well, I think that's hit it. Feel free to email me at matt.richardson@dentoncounty.gov. I'm happy to answer questions or connect you to someone who's got an answer. One of our primary goals is to be the chief health strategists. Public health wants to be the voice of science, and we want to be able to describe what's happening in Denton County, in the nation, and globally.
Well, I want to again thank you, Dr. Richardson, for taking the time. And thanks to all the Denton County officials and volunteers who have been doing this magnificent job of organizing and administering the vaccine to many thousands of residents in need of this vital serum. I've learned a lot from this short time with you, and I think this will be something many people will learn from just watching this video and listening to this, because these are the questions on the minds of many people.
You bet.
So, again, thank you so much. And
Bob, thanks for your time.
have a great weekend.
Take care.
Okay, wait a second.